We have seen earlier about depression as one of the psychiatric disease, and we have seen that it is a unipolar one. Why it is unipolar? That there is only one type of mood, what we call it as a negative mood or lowliness was there. Now we shall see it's another complication which is we call it as a depression, which is present along with the component of aggression. That is, the mood is fluctuating between two extremes, and these two extremes we call it as a bipolar. That is, there are two poles. One pole is, we call it as a which is extreme loneliness, and another one is we usually called as a mania, which is aggressiveness. And so in between these two, the person is always fluctuating. Sometimes it is severely uncontrollable. In some cases, it becomes too low. So this type of situation is there. Same is the case. We have seen various scales which can be used for the determination, as we have seen it in the topic, that is DO. It was there that there are various scales are there, like DS5, like Hamilton scales, like DHQ9. There are various scales are there. These scales will measuring various components or trait, we call it as a behavioral traits of the person, and on the basis of that we can diagnose, we can categorize the patient into a variety of categories. Now let us see various terms which are various commonly present at various places. First one is, what do you mean by mania? What do you mean by hypomania? So mania is mood elevation with functional impairment. Functional means mood is so elevated, but it is very absurd. It is normal. Suppose somebody is abusing, it is not a societal use. The language or the behavior is not societal, or pelting stone, abusing someone. So mood is elevated, but the acts are not socially approvable. So we call it as a functional impairment. While hypomania is there, where the mood is elevation, there is increase in energy. In both cases, there is increase in energy. There is a mood elevation. It is unequivocal, but it does not cause any marked functional impairment. So maybe it is the person is there, maybe talking too much, maybe absurd, maybe showing energy. But these are the signs. They are from mania signs, and both are needed to be present for 7 days as per the DSM-5 requirement. Is only 4 days are required for hypomania. So if they are present for this many days, then we say that it was the case. Otherwise, sometime it can be once or otherwise the case may be.
Then other term
Which is quite
commonly
used is bipolar 1 versus bipolar 2. Again, this is very frequently used in American literature or American countries.
Everywhere this may not be
Everywhere this cannot be used as popularly. Example, and what do you mean by bipolar? One means it is a true bipolar disease, which is having mania. Bipolar 1 means it is a true bipolar disease, it is having mania. Bipolar 2 means it is milder bipolar disease, which is having hypomania. Definitely, depression is common in all. Okay, so it doesn't mean that there is only mania is there. Only thing is depression is there. Along with depression, what kind of mania is, or when the other pole is there, other extreme is there. We have seen there are two extremes are there in bipolar. One is depression, and other is, and it is cyclically, or it is periodically. Sometimes there is a depression which can be very severe, which may go for self-injuries or suicidal attempts, while the mania can be causing causing harm to the
nearby people or the
nearby people
properties
or
of
the
the people.
properties of the people.
Example, pelting stone
Example,
I told you.
pelting stone I
So
told you.
these are two
So these are
extreme
two
the
extreme
person can
the
have,
person can have,
and
and
therefore
therefore
we have got
we
variety
have
of
got variety of
these
these terms,
activities which are there.
activities which are there.
Majority of this
Majority
bipolar
of
disease
this bipolar
present with
disease
one or
present
more
with one or
depressive
more
episodes
depressive
first.
episodes first.
So how we
So
can
how
spot
we
the
can spot
bipolar
the
disease?
bipolar
So
disease?
these are
So
again, as I
the
told you, screening various
again I told you
techniques we
screening
have got.
various
So
techniques
screening
we
for
have got. So
undiagnosed past
screening for
hypomania,
undiagnosed past
uh,
hypomania,
that is, if it was
that
not
is if it was not
diagnosed because
diagnosed
hypomania
because
was there,
hypomania
but
was there, but
many people might have
many
found that
people
no,
might
no,
have
the
found that
person
no,
is
no,
just
the person is just
having
having
more
more
talkativeness or like that.
talkativeness or like that.
So people may not
So people may not
pay much attention,
pay
but if it is
attention,
screened, then we
but if
can
it is
find the
screened, then we can
episodes of
find the
increased
episodes of
energy,
increased energy,
then
then
disinhibition. This
disinhibition.
word is very
This
good.
word is very good.
It has to be
It has to
understood,
be
or this is
understood, or this is
sort of used in the,
sort of
if you have
used in
read
the,
it or
if
if you
you
have
have
tried
read
to
it or if you
understand
have tried to understand
alcohol mechanism of
alcohol
action.
mechanism of
In
action.
alcohol
In
mechanism of
alcohol
action,
mechanism of
when
action,
people say
when
that
people say that
initially it causes
initially it
CNS
causes
excitation,
CNS
or it
excitation, or it
causes openness,
causes
or it is
openness,
causes a
or it is
party
caused
drink,
as a party drink.
very
Very
commonly called about
commonly
alcohol
called
is this.
about alcohol is
So
this.
what do you
So
mean
what
by
do you
this party
mean by
drink,
this
or
party
it causes
drink,
this?
or it
So
causes this?
pharmacologists,
So
they have
pharmacologists, they
example
have
like Human-Gilman
example
and
like
other
Human-Gilman and
pharmacologists
other
have put it in very
pharmacologists have
nice
put it
way,
in very nice
which
way.
says that it is
It
not
says that it is
excitatory.
not
Alcohol is not
excitatory.
at all
Alcohol is not at
excitatory,
all
but in
excitatory.
initial one, it is
But in
inhibitory only.
initial one, it is
But
inhibitory
in
only.
initial
But in
doses, or
initial
initially it
doses, or
causes
initially it
inhibition of
causes
inhibition.
inhibition of inhibition.
So inhibition of
So
inhibition
inhibition
means
of
what? We
inhibition
have
means
being a
what? We
social
have
animal,
being a
we have got
social animal, we
inhibitions.
have got
Will
inhibitions.
not talk
Will
absurd, will
not talk
not talk
absurd, will
rubbish,
not
will
talk
not
rubbish, will
do
not
the things
do
which
the
are not
things which are
acceptable to
not
society.
acceptable to society.
And there are
And
many such
there are
things
many
because of
such things
inhibition. Maybe
because
we
of
do not like
inhibition. Maybe
some
we do
person,
not like some person,
will not
will not
start abusing him
start
because
abusing him because
our values, our
our
ethics,
values,
they
our
do not
ethics,
permit.
they do not permit.
Then what happens
Then
if
what
there is a
happens if there is
disinhibition?
a disinhibition?
Then that inhibitory
Then that
control,
inhibitory control,
that
that
how we
control,
should
that
behave
how
in a
we should
society,
behave in a
that goes,
society, that
that
goes,
lost.
that lost.
And then it becomes
And then it becomes
disinhibition, and
disinhibition,
this
and
is
there,
then seen.
this is
So when we see
seen.
that
So when we see
hypomania,
that
then we'll see
hypomania,
that the
then we'll see
talk,
that the
although
talk, although
it is comparatively
it is
lesser than
comparatively
mania,
lesser than
but
mania,
still this
but still
disinhibition
this
can be seen. If
disinhibition
you'll
can
see
be
that the
seen.
person is
We
having
see
many
that the
loose
person
talk,
is having many
and
loose talk,
many
and many
things which are there,
things which are
otherwise the
there.
person should
Otherwise,
not
the
have
person should not
spoken,
have
or
spoken,
should not, the
or
things
should not
they
the
are
things
that the
they are
patient person should
the
not have done.
person should not have
Then
done.
there is a reduction in
Then
the
there is a
sleep, which
reduction
is
in
a
the
part
sleep,
of
which is a part
hypomania.
of hypomania.
Grandiosity, feeling
Grandiosity,
very big
feeling
about
very
oneself.
big about oneself.
He will feel
He
that
will
he is
feel
something
that
very
he
big
is something
person.
very
That is
person.
called as a
That is called
grandiosity.
as a
So
grandiosity.
grand,
So
you know,
grand,
it's a
it's a grand
grandness the person is
grandness the
feeling,
person is
and
feeling,
irritability.
and
Even small
irritability. Even
provocation
small
will result
provocation
into
will result
the
into
problem.
the problem.
Then what are
Then
the out of
what are
character
the out
cause
of character
problem which
cause
and with
problem which and with
their out of
their
character
out
means
of character means whatsoever things,
whatsoever things are to
even
be
whatever
done,
things are to be
they are
done,
not done
they are
properly.
not done
Then there
properly.
are
Then there are
problems are there,
problems are there.
they are regretted.
They are regretted.
Then whether
Then
how
whether
long means
how
that has
long
to be
means
checked
that
during
has to be
treatment,
checked
whether it
during
was for,
treatment,
as we
whether
have
it
seen,
was
4
for,
days
as we have
7
seen,
days,
4 days,
for
7
how
days,
much there
for how
it
much
was
there
there.
it was there.
Was the patient
Was the
on
patient
any
was on any
antidepressant or stimulant
antidepressant
at
or
that time?
stimulant
If
at
it is
that
on
time? If it is on
antidepressant, then there are
antidepressant,
chances that
there are
it
chances
is the
it is the
additional activity, or
additional
it is
activity, or
increasing
it
the
is increasing
activity
the
because of this,
activity because of this,
or
or
overcoming the depression.
overcoming the
These
depression.
actions are
These
there, or
actions
some
are there,
CNS
or
stimulants
some CNS
like
stimulants
cocaine,
like
etc., are
cocaine,
there which are
etc., are
given.
there which are given.
And check about the
And check
family
about
history of
the family
bipolar
history of
disease. So if
bipolar
these all
disease. So if
screening
these all
techniques
screening
or
techniques
screening
or
tools, they
screening
allow
tools,
that
they allow that
diagnosis, then it means that person is having,
it
or
means
person
that
was
person is
suffering
having,
from
or person was suffering
bipolar
from
disease.
bipolar
Then we
disease.
can have for
Then we can have
differential
for
diagnosis.
differential diagnosis. Once we understand
Once we
that
understand
the
that the
person
person
has
has got
got
bipolar,
bipolar,
then what
then
kind of
what kind of
bipolar it
bipolar
is.
it
So we
is.
call it as a
So we call it as
bipolar
a bipolar differential
diagnosis. So
diagnosis.
first one is
So first
whether it
one
is a
is whether it is a
bipolar
bipolar
disease, that is bipolar
bipolar
depression,
depression,
or it is
or
emotionally
it is
unstable
emotionally unstable
type of disease,
type of
particularly
disease,
even
particularly even
Parkinsonism disease, it
Parkinsonism
happens.
disease, it
Then
happens.
another one is the
Then
cyclothymia.
another one is
Thymia here
cyclothymia.
it means
Thymia
your
here
mood.
it means your
So
mood.
mood is
So
how it
mood
is.
is how it is.
Normally, we'll
Normally,
see the
we'll see
graph-like
the
structure that
graph-like
there is
structure
a
that there is a
euthymia means
euthymia
normal
means normal
behavioral, no
behavioral,
mania, no
no
depression.
mania, no
Then
depression. Then
uh,
uh,
the up
the
and
up
low
and low
in thymia, that
in
means
thymia, that
increase
means
in the mood
increase
and
in the
decrease in
mood
the mood.
and decrease
Increase
in
in
the
the
mood,
mood than normal,
increase in the mood
and
than
decrease
normal,
or
and
elevation of
decrease
mood
or
than
elevation
normal,
of
and
mood
decrease
than
in the
normal,
mood.
and decrease in
And
the mood. And
cyclothymia means it is
cyclothymia means it is
repeatedly occur in
repeatedly
cyclic
occur in
manner.
cyclic manners.
Okay, periodically
Okay,
it is happening
periodically
that
it is
up goes
happening that
then
up
down,
goes
up
then
and
down,
down. So
up
this
and down. So
cyclic
this
continuous is
cyclic
going on.
continuous is going
So
on.
this type of
So
thing is
this
called
type
as
of
a
thing is called as a
cyclothymia. Then
cyclothymia.
organic
Then
bipolar
organic
disorder.
bipolar disorder.
Organic means where
Organic
some
means where some
drug has caused
drug
some
has caused
lesions in the
some
brain.
lesions in the
So
brain.
there is a
So
problem
there
in
is
the
a
organ,
problem in
that
the
is
organ,
brain.
that is brain.
So
So
normally,
normally,
in other
in
cases,
other
there is a
cases,
problem in the
there's a
CNS,
problem in the
this
CNS,
neurotransmitter.
this
That
neurotransmitter. That
neurotransmitter either they
neurotransmitter
are
either they are
more or less
more
in
or less in
amount,
amount,
and therefore we
and
are seeing
therefore
this
we are
sign
seeing
because
this sign, because
neurotransmitter are in
neurotransmitter
brain. This
in brain,
neurotransmitter
this neurotransmitter
are
are
responsible for each
responsible
and
for each
everything,
and
whether it is
everything,
our
whether it
thinking,
is
whether
our
our
thinking, whether
emotions,
our
whether
emotions,
our
whether
memory. So
our
it
memory.
everything
So
is driven
everything
by
is driven by
neurotransmitters. We don't have
neurotransmitters.
any
We
other
don't
thing
have
in
any other
brain.
thing in
There are
brain.
nerves,
There are
neurons,
nerves, neurons,
and some other
and
cells
some
like
other
glial
cells
cells
like
or
glial cells or
supporting cells,
supporting
and
cells,
most
and
important, all
most important, all
the secretion of
secretion
neurotransmitter
of
and acting
neurotransmitter
on the
and
receptor.
acting
So
on the receptor.
all
So
our actions,
all our
all our
actions,
thinking,
all our
all our
thinking,
learning,
all our
all our
learning, all
memory,
our memory,
all our
all
responses,
our
everything is
responses, everything
basically
is
on chemicals.
basically on chemicals.
So this is what
So this is what
at some places
at some
and some
places
movies
and
they
some
call it as a
movies they call
chemical
it as a
locha.
chemical
That
locha.
is some
That
chemical
is some
changes are
chemical
there, and
changes are
therefore
there,
people
and
are
therefore
behaving.
people
So
are
this is
behaving.
what
So this is what
psychiatric diseases.
psychiatric
But in
diseases.
some
But
cases
in
it
some
can be
cases it
organic.
can be
Normally we
organic. Normally
categorize
we
them as a
categorize them as a
neurological one, where
neurological one,
there
where
is actually
there is
damage to
actually
one
damage
or
to
other
one
neuron.
or
So
other
here
neuron. So
organic
here
bipolar
organic
disorder means
bipolar disorder means
it is particularly
it is
onset is
particularly
after
onset is
age of
after
40.
age of
It
40.
is
It is
unexpected,
unexpected,
and there are
and
some drugs
there are
like
some drugs
steroid,
like steroid,
levodopa, thyroid,
levodopa,
cortical
thyroid,
lessons are
cortical
there,
lessons are
and
there,
because of that,
and because of that,
there is
there is
damage, or some
damage,
of the
or
area
some
is
of the
not
area is not
normal as it
normal
should have
as
been,
it
and
should have been, and
from that
from
area it is
that
resulting into
area
bipolar
it is
disorder.
resulting into bipolar disorder.
The one more
The
category
one
is
more
there that is called
category is
as
there that is called as
schizoaffective disorder. So
schizoaffective
whatever
disorder.
these
So whatever
disorders
these
are there,
disorders are there,
may it be
may it
depression,
be depression,
unipolar, may it be
unipolar,
mania,
may it be
unipolar,
mania,
may it be
unipolar, may it be
bipolar disorder,
bipolar
where
disorder, where
both are there,
both are
mania as
there,
well as
mania as well as
this depression is
this
there. So
depression
in
is
all
there.
cases,
So in all cases,
these are we call them
these
as a
are we call
affective
them as a
disorder because
affective
they are
disorder,
affecting
because
the
they are
mood.
affecting the mood.
So
So
since they are affecting
since
the
they are
mood, they are
affecting the
affecting the
mood, they are
behavior.
affecting
We
the
call it as
behavior.
a
We call it as a
mood disorders or affective
mood
disorders.
disorders or affective
While
disorders.
there is
While there is
another condition that is
another
we call it
condition
as
that is we call it as a
schizophrenia. In
schizophrenia.
addition to
In addition
these
to
mood-like
this
changes,
mood-like
but there
change,
are many other
but
things
there
like
are many other
hallucinations,
things like
the
hallucinations,
changes
the
in the
changes in
perceptions,
the perceptions,
and
and
all of a sudden
all of
changes
sudden
in the
changes in the
thinking patterns will be
thinking
changing.
patterns will be
So this
changed.
kind of
This
things
kind
are
of
called as a
things are
schizophrenia,
called as a
which is called as a
schizophrenia,
split
which is called as
personality.
a
We shall
split
be seeing
personality. We shall be seeing
schizophrenia differently,
schizophrenia
but
differently.
in
But
many patients it
in
has been
many
found
patients, it
that
has been found
along
that
with this affective
along this
disorder, may it
affective
be
disorder,
depression
may
or
it be depression or
bipolar disorder,
bipolar disorder,
there is a
there
component of
is a component of
schizophrenia also.
schizophrenia
That means it
also.
is a
That means
mixture
it
of
is a mixture of
schizophrenia and
schizophrenia
bipolar
and
disorder. So we call them
bipolar
as a
disorder. So we
schizoaffective
call them as
diseases.
a schizoaffective
Okay,
diseases.
and then
Okay,
we
and then
strike
we
to degree of
strike to
bipolar
degree of
disease
bipolar
disorder, whether it is
disorder, whether it is
milder, whether it is
milder,
moderate,
whether it
whether
is
it is
moderate,
severe,
whether it is
and
severe,
accordingly
and
all these
accordingly
differential
all these
diagnosis.
differential
Then we
diagnosis.
can go for
Then we can go for
various treatment.
various
Before
treatment.
treatment, we
Before
also go
treatment,
for
we also go for
checking what whether
checking what way
comorbidities are there or co-foundings
comorbidities are
are
there
there.
or co-foundings
So
are there. So
whether the person is
whether the
having
person is
any
having
other
any other
psychiatric or neurological
psychiatric or
disorder,
neurological
even
disorder, even
schizoaffective is also having
also
one
having
or other kind
one
of
or other
mixer,
kind of
then
mixer,
whether person
then
are
whether
taking
person are taking
alcohol or any other
alcohol
drugs
or any
which
other
may have
drugs
any
which may have any
role into it,
role into it,
then there are anxiety
there
disorders are
anxiety
there.
disorders are there.
What are
What
this
are
kind of
this kind
anxieties?
of
Again, we
anxieties?
have a
Again,
separate
we have
topic
a
on that.
separate
We shall
topic
be
on that. We
discussing
shall
it.
be
But
discussing it.
whether these are
Whether these are
simultaneously existing,
simultaneously
because they also play
existing,
their
because
own
they
role
also play
into it.
their
They
own
also
role
play
into
their
it. They
importance
also
into
play
it.
their importance into it.
Then
Then
how we are
how we
making
are making
this
this
bipolar disease with
bipolar disease with
no, partial
the
one or
partial one or
single type of
single type of
this disease in it.
this disease in it.
So
So
distinguishing features are
distinguishing
there.
features
It
are
is
there. It
personality
is personality
is there. It is not a
is
illness,
there. It is not a
because there
illness,
are
because there are
personality changes
personality
are there. We call them
changes
a
are there. We
trait,
call them a
or
or
there was very
there
good
was very good
this one
uh,
very good
very good
what we can say efforts
what
were
we can
made.
say efforts were made.
Very
A very
dangerous story is
dangerous
there,
story is
and
that,
there is
and
one
there is one
society that is known as a
society that is
CCHR,
known as a
which is in
CCHR,
UK
which is
and
in
working in
UK
US.
and working in
It is
US.
a
It
non-profit
is a non-profit
societal organization,
societal organization,
and they have
and they
realized, or
have
they have put
realized, or
it, they
they
have
have put
proven
it
it, that how
proven that how
medicine companies are
medicine
doing it.
companies are doing it.
It was very
It was very
big movement
big
this
movement this
CCHR has
CCHR has
moved.
moved.
So they found
So
that
they found
what
that
happened is
what happened is
there was one
there was one
doctor who was
doctor who was
hired or rather
hired
paid
or
by
rather paid by
GlaxoSmithKline, which is
GlaxoSmithKline,
GSK,
which
which
is
is very
GSK,
big
which is very
company,
big
because
company,
that
because
company has
that company
manufactured
has
one
manufactured one
new drug that was
new drug that was
paroxetine.
paroxetine.
Now what happened is
Now, what
the
happened is the
paroxetine was almost
paroxetine was
similar to
almost similar
fluoxetine,
to fluoxetine,
and
and
then it will not
then
get
it
any
will
patent
not get any
benefits.
patent benefits.
So what they did
So
is
what they
the
did is
doctor,
the doctor
they tried,
they
they supported doctor,
supported
and the
doctor,
doctor
and the
got
doctor got
elected, or doctor got
elected, or doctor got
elevated as
elevated
a
as
big position
a
in
big
the
position in
psychiatric
the
societies.
psychiatric societies.
Then initially they
Then
wrote
initially they wrote
articles on
articles on
sort of disease
a
which
sort
was
of
not
disease
existing
which was
earlier.
not existing earlier.
That was called as
That
a
was called as a
what we can say
what we can say
social phobia.
social phobia.
And that social
And that
phobia,
social
that
phobia,
means the person
that
is
means
not
person is or
earlier what we call it as a
earlier what we
shyness.
call it as a shyness.
But they said that
But they
social
said
phobia
that
is a
social
dangerous
phobia
and
is
it
a
is part of a depression, because all
dangerous, and it is
phobias are
part of a
actually
depression,
depressions.
because all phobias are actually
Now,
depressions.
for
Now,
that they said
for
that for
that they
social
said that
phobia the
for
best
social
drug is
phobia the best drug is
paroxetine, and the
paroxetine,
paroxetine was
and the
prescribed like
paroxetine was
anything.
prescribed like anything.
By the time this
By the
was
time
found,
this
it was too
was
late, and
found, it was
company
too
has
late,
earned
and
a lot
company has earned a lot
big profit on this
big profit
paroxetine.
on
So
this
this is how
paroxetine. So this is how
unethical things are going
unethical
on.
things are going on.
So this can be,
So
we
this
call
can
them
be,
as a
we call
personality
them as
traits.
personality
Some
traits.
people may not
Some
be
people may not be
having
having
we have many
we
such
have
words are
many such
there.
words are
We
there.
call
We
shyness, we
call
call
shyness, we
openness, we
call
call
openness, we
introvert, we
call
call
introvert, we
extrovert.
call
Now,
extrovert.
therefore,
Now,
it becomes very
therefore, it
difficult.
becomes
Therefore,
very
this is
difficult.
difficult
Therefore, this is
because
difficult because
first important thing
first
which we have seen
important thing
earlier,
which we
that
have
we
seen
don't
earlier,
have
that we
any
don't have any
significant
significant
diagnostic modes.
diagnostic
Just like
modes.
in
Just
cardiovascular
in
system,
cardiovascular
you have
system,
checked, you have
you have
gone for
checked, you have
ECG, you
gone
have
for
gone for
ECG, you
2D
have gone
echo,
for
or you have
2D
gone for
echo, you have gone
angiography,
for
you got
angiography,
the
you
diagnosis.
got the
Yes, now
diagnosis.
this is
Yes, now
happening.
this is happening.
We don't have anything
We
where
don't have
it can
anything
go
where
into
it can
brain
go
and it
into
can
brain and it
check
can
what is
check
happening.
what is
There are
happening.
no thing,
There are no thing,
impacts which are
impacts
occurring
which
on
are
the CT
occurring on the
scans
CT
or maybe
scans or
MRIs,
maybe
whatever
MR,
brain things are, because brain is
whichever
normal.
brain things are,
Only
because
thing
brain is
is some
normal.
are the
Only
some
thing is
chemicals are
some chemicals
slightly
are
increasing or decreasing
slightly
in some
increasing
of
or
the
decreasing
areas,
in some
and
of the
that is
areas,
affecting
and
the
that is
thinking
affecting the
procedure,
thinking procedure,
or to what we call as a
or to
mood.
what we call as a
So in
mood.
that cases,
So in
the
that
biggest
cases,
problem
the
is this:
biggest problem is this is
how to
how
distinguish,
to
how to
distinguish, how
identify
to
what it is there.
identify what it is there.
So it is
So it is
the trait of the
the trait
personality.
of
The person is having,
personal, the
as I
person
told you, the
is
person
having,
can be
as I
shy, the
told you, the
person
person
can be
can be shy,
introvert, the
the person
person
can
can
be
be
introvert, the
extrovert.
person can be
So this type
extrovert.
of
So
personality
this type
traits
of
are there,
personality
and
traits are
that has
there,
to be
and that
distinguished.
has
So
to
these
be
scales will
distinguished.
be
So these
helping us.
scales will be helping
Various
us.
techniques are there that
Various
will be
techniques
helping
are
us
there
to
that will be helping
understand
us
what
to
are various
understand what are various
situations into it.
situations into it.
Then pervasive
Then
efforts to avoid
pervasive efforts to
abandonment
avoid abandonment
of it. Then features which are
then
fluctuating in the
features that
response to
fluctuating in the
relationship, that
response to
is acting
relationship,
out,
that
and
is acting
anger.
out, and anger.
So again,
So
sometimes
again,
whether
sometimes
it is anger
whether
or
it
it is
is
a
anger or
mania,
it
it
is a
has to be
mania,
checked,
it
it
has
has
to
to
be
be
checked, it
confirmed.
has to be confirmed.
chronic feeling of emptiness,
chronic feeling
or
of
it is a
emptiness,
depressive
or it
symptom,
is a
or it is
depressive
poor
symptom, or it is poor
self-image,
self-image,
then absence of
then
true
absence of
hypomanic
true
episodes,
hypomanic episodes,
whether there are
whether there are
true or false
or
hypomanic
false
episodes. We have seen what
hypomanic episodes.
hypomania
We
is
have seen
there.
what hypomania is
So
there.
this kind of
So this
differences in the
kind of differences in
characteristics
the
of mood
characteristics of
instabilities
mood
are there, that has
instabilities
to
are
be
there, that has to
identified,
be
this has to be
identified,
checked,
this has to be checked,
and simultaneously there are
and simultaneously
some
there are
comorbid
some
situations are
comorbid
there,
situations are
which can
there,
result into
which can
worse
result into
outcomes,
worse
because this
outcomes,
comorbid
because this
also
comorbid
playing their own
also playing their
important
own
role
important
into
role
that disease.
into that disease.
It
It
blinds clinician to
blinds
diagnose of the
clinician to
bipolar
diagnose of
disease,
the bipolar disease,
and presence of
and presence of
this VPD, it
this
increases
VPD, it
case
increases
for the
case for the
psychotherapy.
psychotherapy.
So next is, what is the
So it is,
bipolar
what is the
depression?
bipolar depression?
It causes more
It causes
morbidity
more morbidity
than the maniac
than the
phase,
maniac phase,
and in that
and in that
SSRIs or
SSRIs or
antidepressants are largely
antidepressants are
ineffective,
largely
and they may
ineffective,
precipitate
and they
hypomania or rapid
precipitate
cycling is
hypomania
there.
or rapid cycling is
So
there.
they are not that
So they are
effective,
not
they are
that
not
effective,
very
they are
good.
not
So here
very good. So
we are
here
starting with
we are starting
various
with
categorization
various
also,
categorization also,
and we are
and
trying with
we
the
are trying with
better
the
treatment for
better
that. So in
treatment for
case of
that. So in
bipolar
case of
depression,
bipolar depression,
SSRI, although they are
SSRI, although they are
antidepressant, but
antidepressant,
in
but
bipolar
in
depression we
bipolar
have to avoid
depression we
it,
have to
because they
avoid
are
it
largely
because they are
ineffective,
largely effective,
and they may
and
precipitate
they may
in
precipitate
hypomania.
in
We have seen
hypomania. We
hypomania
have
is
seen
also not
hypomania
good.
is
It
also
is
not good. It is
maniac phase,
maniac
only
phase,
less
but
than
only
mania,
less than mania,
or it causes
or
rapid
it causes
cycling. That
rapid
is,
cycle.
you
That is
what we can say,
what we can say.
cyclothymia we have seen,
Cyclothymia we have seen,
cyclicness
the
of the
cyclicness
mood,
of the mood,
and hence
and
recognition of
hence
the
recognition of the
bipolarity is important.
bipolarity is important.
And once we
And
diagnose it
once we
properly,
diagnose it
it will
properly,
lead to
it
different
will lead
treatment
to different
algorithm.
treatment algorithm.
It is clinically
It is clinically
similar
similar
to
to
unipolar depression,
unipolar
but here
depression,
what we
but
have
here
got,
what we
here
have got,
psychotic
here
changes are
psychotic
there,
changes
atypical features are
typical
there,
features are
which can
there,
raise
which can
suspicion,
raise
and
suspicion,
family
and
histories is
family
there,
histories is
family
there,
history
family
mentioned
history
earlier.
mentioned earlier.
That all will be
That all
helping
will
to
be
understand
helping
whether
to
it is a
understand whether it is
unipolar
a
or bipolar
unipolar or
depression.
bipolar depression.
So what are the drug
So what are
treatment
the
for
drug
bipolar
treatment for
depression?
bipolar depression?
First one is
First one is
quetiapine.
quetiapine.
First line is
First line is then
it can be
it can be
fluoxetine plus
fluoxetine
olanzapine,
plus
not
olanzapine, not
fluoxetine alone.
fluoxetine alone.
Okay, or
Okay, or
olanzapine.
olanzapine.
Then second line
Then
is
second line
fluoxetine
is
plus
fluoxetine
olanzapine.
plus olanzapine.
Then quetiapine,
Then
means here
quetiapine
only
means
first
it
and second
only
brand we
then
are changing.
brand we are
Here
changing.
instead of
Here
quetiapine
instead of
was
quetiapine
first
was
line.
first in
Here in
first line.
second line
Here
it
in
becomes
second line
second.
it becomes second.
Then next is
Then next is
lamotrigine. Lamotrigine
lamotrigine.
is actually
Lamotrigine is actually
one of the
one of
antipsychotic
the
drug.
antipsychotic drug.
Anti-epileptic drug,
Anti-epileptic drug,
and
and
it can be given
it
along
can be
with
given along with
quetiapine. These are various
quetiapine. These are various
combinations are
combinations are
there.
there.
Then bipolar depression.
Then polar
In that,
depression, in that
quetiapine has found to
quetiapine
be
has found to be
very good one.
very good one.
It has got
It
good
has got good
evidences.
evidences.
It has got
It
less
has
weight
got
gain.
less weight gain.
Again, if you have studied or
If
if
you
you
have studied
remember,
or if you remember,
then
then
olanzapine in this class
olanzapine
has
in this
got
class has
very
got
high weight
very
gain,
high
and
weight
it
gain,
got
and it
metabolic
got
syndrome.
metabolic syndrome.
And this
And this
olanzapine therefore
olanzapine
is
there
not allowed,
is
although
not allowed,
maybe it is
although
good in
maybe it is good in
psychotic conditions.
psychotic conditions.
But
But
simultaneously,
simultaneously, if it causes
it
weight
cannot
gain,
be used
it
in the
cannot be used in the
obese people, or the
obese
people
people or
which
the
are having
people
high
with
risk of either hypertension
high
or
risk of
metabolic
either
disorders
hypertension
like
or metabolic disorders like
diabetes or
diabetes or
cardiovascular
cardiovascular
problems. So in that
problems. So
olanzapine
in
we
that
cannot use
olanzapine
because
we
it
cannot
increases
use
obesity.
because it increases
It
obesity.
affects,
It
or it
affects
is
or
useful in
it
anxiety
is
and
useful in
sedation
anxiety
also.
and sedation also.
And we can have
And we
various
can have
doses.
various
It can
doses.
starting
It
with
can
the low,
starting
and
with the
then
low,
if
and
there
then
is a sedation,
if there is
we
a
can
sedation, we can
warn about sedation.
warn
That
about
yes,
sedation that
it should
yes,
not be
it
taken
should
if
not
the
be
person is
taken if
feeling
the person is feeling
sedated or sleepy,
sedated or
or
sleepy,
person should
or
not work
person should not
any
work
important task
any
like
important
driving,
task like
etc.
driving, etc.
During the
During
treatment of
the
this
treatment of this
quetiapine.
quetiapine.
Normal dose is
Normal dose
less than
is
300
less than
milligram per
300
day.
milligram per day.
Then another is
Then another
lamotrigine.
is lamotrigine.
It has
It has
reasonable effect as a
reasonable
sole
effect
agent,
as a sole agent,
but it is
but it
useful
is
adjunct
useful
if
adjunct
this first
if
line
it is first line
treatment is
treatment
ineffective.
is
If the
ineffective.
other
If
drugs we
the
have seen
other
like
drug we have
quetiapine
seen like
or
quetiapine or
combination of
combination
olanzapine
of
and
olanzapine and
fluoxetine, they are not
fluoxetine,
useful,
they are
then we
not
can
useful,
add
then
lamotrigine.
we can
It is well
lamotrigine.
tolerated,
It is well
but
tolerated,
slow
but
titration.
slow
It
titration.
have the
It
risk slow
have the risk
titration.
slow
I hope
titration.
you
I
have
hope
gone through the
you
word
have gone through the
titration
word
during
titration
therapeutics.
during
Here
therapeutic.
therapeutics
Here
titration
therapeutics
means the
titration means
dose
the
titrations.
dose
The
titrations.
dosages
The
are to be
dosages are to be
to check
titrated
which dose is the
which
most
dose is the most
optimal dose
optimal
is,
dose,
and for that
and for
it is
that
sort of trial and
it
error
is sort of
activities
trial
is
and
done,
error
and
activities is done,
continuously monitoring is done. And then once the
and then
dose is
once the dose
finalized,
is
we call it
finalized
as
we
if
call it
yes, we
as
have
a yes, we have
titrated or we have
titrated
successfully
or we have successfully
optimized the dose. So
optimized the dose.
it has to
So
be done
it has
slowly
to be done
only. We
slowly
cannot go
only. We cannot
rapidly
go
about
rapidly about
dosage.
dosage.
It has got risk
It
of
has got
Steven
risk of
Johnson
Steven
syndrome,
Johnson syndrome,
and in various
and
conditions it
in various
causes
conditions it causes
reduction in the lamotrigine
reduction in the
level.
lamotrigine level.
So there are risk
So
of
there are risk
toxicity
of
even in the
toxicity
pill-free
even in the
week.
pill-free week.
So there are
So
some
there are some
pill-free weeks are there.
pill-free weeks are there.
In that it is there.
In that it is there.
So these are
So these are
various
various
treatments.
treatments.
Then lamotrigine augments
Lamotrigine
quetiapine in the
augments
bipolar.
quetiapine in the bipolar.
It has been
This one
found
it
that
has been
when
found that
lamotrigine
when
is added,
lamotrigine is
then
added, then
it is
it
effective
is
and it
effective and
increases
it
the
increases the
remission. That is, it is
remission, that
36%
it
remission
is 36%
as
remission
compared to
as compared
16%
to
in placebo.
16% in placebo.
And lamotrigine
And
dispenses
lamotrigine
are impaired
dispenses
by
are
folic
impaired
acid.
by
Folic
folic
acid
acid. Folic acid
is increasing
is
the metabolism of
increasing the
lamotrigine,
metabolism of
because
lamotrigine,
folic acid is a
because folic acid
coenzyme,
is a coenzyme,
and therefore
and
this
therefore
folic
this
acid is
folic
causing
acid is
impairment
causing
of the
impairment of the
lamotrigine, and therefore
lamotrigine, and
decreases that.
therefore decreases
So
that.
what are the
So what
psychosocial
are the
aspect of the
psychosocial
bipolar
aspect of the
disease? So
bipolar disease?
what
So
we need
what we
to do
need
is,
to do is,
so we go for
so we go for
psychoeducation.
psychoeducation.
That is, we have to
That is, we have to
we call it as
we
CBTs,
call it as a
cognitive
CTs,
behavioral
cognitive
therapies.
behavioral therapies.
So we
So
check
we
what
check
are there,
what are the
triggers which are
triggers which are
resulting into
resulting
either maniac or
into either
hypomanic
maniac
phase or
or hypomanic phase or
depressive phase.
depressive phase.
Then if it is
And
there,
then
if
if
you
it
have
is there,
seen
if
or
you
you
have
have
seen or
studied,
you have studied,
even though it is there in
even though
our
it is there
syllabus
in our
also, pain
syllabus
and
also,
migraine.
pain and
So in
migraine.
migraine
So
we
in
get
migraine we
some
get some
initial indication. We
initial
call it as a
indication. We
aura.
call it as a aura.
So similarly,
So
whether
similarly, whether
if we can
if we
recognize
can
the early
recognize
signs
the
of the
early signs of
person, that
person,
whether this person is having
whether this person is
such kind
having
of
such kind of
patterns, then
patterns,
in that
then
case we can
in that case
recognize
we
it,
can
we can check
recognize
it.
it, we can check it.
Check for the early
Check for the
interventions
early
like
interventions
sleep
like
hygiene, that is allowed
hygiene, that is
to sleep, because
allowed
if the
to
sleep
sleep,
is
because
not proper,
if the
once the
sleep is
person
not
is not
proper, once the
sleeping, then
person
it
is
can
not
be
sleeping,
affecting.
then it can be affecting.
Importance of medications,
Importance of
compliance,
medications, compliance,
involve family,
involve
if
family,
it is there,
family. If it is
family's
the
love, affection,
family
support,
love,
it
affection,
helps in
support,
the
it helps in the
overcoming of the diseases.
overcoming of the diseases.
Check about the
Check
lifestyle
about the
advices.
lifestyle advices.
Then
Then
make the routines
make the
regular,
routine
avoid drugs,
regular,
avoid
avoid drugs,
alcohol,
avoid alcohol,
improve the sleep
improve the sleep
patterns,
patterns,
and other formal
and other formal
psychotherapies, including
psychotherapies, including
this
this
cognitive behavioral therapy.
cognitive
It
behavioral
has
therapy.
got little
It has
evidence
got
that
little
it may
evidence
be
that
helping
it may
much,
be
but yes,
helping much,
they
but
can still
yes,
be
they
added.
can
They
still
can
be
still
added,
be
they can
present.
still be
We call
present.
it as a
We call it
cognitive
as a
behavioral therapy.
cognitive
Means
behavioral therapy
here
means
the
here the
practicing
practicing
psychotherapists are there, which
psychotherapists are there
take
which
sessions, which
take
causes
sessions, which
counseling,
causes
and
counseling,
on the
and
counseling
on
they
the
advise,
counseling
they
they
suggest,
advise, they
and
suggest, and
accordingly they
accordingly
find some
they find some
impact on the person.
impact on the person.
So what can be
So
the, we have
what
seen
can be the,
earlier
we have
two
seen
lines,
earlier
that is
two
first
lines,
line
that is first
and
line
second line.
and second line.
Then there are
Then there are
few more
few
example
more
of these
example
third
of
line
these
drug like
third line drug like
durasidone. It is
durasidone.
actually newer
It is
analog
actually
of
newer analog of
ziprasidone, which is one of
ziprasidone,
the
which is one of
atypical
the
antipsychotic
atypical
drug.
antipsychotic drug.
This durasidone
This
is a newer one.
durasidone is a newer one.
On ziprasidone we can have
Ziprasidone we
example,
can have
or
example, or
aripiprazole. It is
aripiprazole. It
found to
is
be very
found to
effective
be
in
very
resistant
effective in
cases,
resistant cases,
and we can add
and we
either
can add
valproate
either
or
valproate
lithium.
or
And lastly, if it is too
and
big,
lastly,
it
if
is
it is
too
too big, it is
problematic,
too
then
problematic, then
electroconvulsive therapy.
electroconvulsive
If you
therapy.
know about
If
it,
you know
or
about it,
normally in movies
normally in
people show
movies people show
कि जो
कि जो
in
in
maniac phase, those which are
maniac
very
phase, those
aggressive,
which are very
in that
aggressive,
patients
in
they
that
give
patients they
mental
give
shock.
mental shock.
Their two
The
electrodes are
two
attached to
electrodes
brain,
are
and
attached
then
to brain, and then
shock therapy is
uh,
given.
steroid
So
is
this is
given.
the
So this is the
electroconvulsive therapy, or
electroconvulsive
the
therapy, or
person
the
then
person then
given
is
very high
given very
or
high,
quite high voltage
quite
shock,
high voltage shock,
more than the
more than
brain's
the brain's
impulses, so that all
impulse
this
test. That all
thinking,
this
all the impulses
thinking,
will
all
be
the
stopped, and
impulses will
then
be
they will
stopped,
be
and then
arranged
they
in
will
a
be
new way.
arranged in a new
So
way.
this is how
So
the
this is how
treatment is
the
there in
treatment
the
is there
bipolar,
in the bipolar,
this is the third
but
line
this is a
treatment.
third line treatment.
Then
Then
prophylaxis.
prophylaxis.
What we
What
can do to
we can
prevent
do
the
to
further
prevent the further
problem? What can
problem?
be the our
What can be our
prophylactic mechanisms?
prophylactic
So
mechanisms?
let us see
So
what
let
we
us
can
see
do
what
is,
we can do is,
consider after a single
consider
maniac
after a single
episode,
maniac episode,
and
and
when there is a
when
single
there is a
manic
single
episode,
manic
then
episode,
we should
then
try
we
to
should
go
try
for
to go for
prophylactic treatment.
prophylactic treatment.
And after
And
second
after
one, if
second
already
one,
we have ignored the
already
first
we
one,
have
then
ignored the first
if
one,
there are
then
two
if
episodes
there
have
are two
occurred,
episodes have
then
occurred,
definitely we
then
have to go.
definitely we have to go.
The lithium, it
The
remains
lithium, it
first line
remains first line
anti-suicidal drug. If you
anti-suicidal
remember our
drug. If you
previous
remember our previous
augmentation and all, we have
augmentation
found
and
that
all,
it
we
was
have found
one
that
of the
it was
very good
one of the
agent,
very good agent,
and it has
and it
caused
has
very good
caused very
remissions
good
and very
remissions
good
and
effects
very good effects
in various kind of
in various
patients.
kind of
Then
patients.
another one is
Then
sodium
another one is
valproate. We
sodium
can add
valproate. We can
uh,
add
sodium valproate is
sodium
again
valproate is again
agent which is
agent which is
used or practiced
used
in
or practiced
epilepsy,
in epilepsy,
and it
and
can improve
it
the
can
GABAergic
improve the
mechanism.
GABAergic mechanism.
Then next one is
Then
the
next one is
combination of lithium
combination
plus
of lithium
valproate
plus
you can add
valproate you
into.
can add into.
Then
Then
quashiapine,
quashiapine,
lamotrigine, these are
lamotrigine,
there.
these are there.
Lamotrigine is not
Lamotrigine
good
is not
anti-maniac
good
agent, but yes,
anti-maniac
it
agent,
can
but yes,
control
it can control
the depressive
the
phase very well.
depressive phase very well.
Then
Then
carbamazepine, it
carbamazepine,
is a weak
it is a
evidence.
weak
Now it
evidence.
is not used
Now it
that
is
much.
not
It is
used that
rarely
much. It
used.
is rarely used.
And once the
And once
prophylaxis
the
is stopped,
prophylaxis
then
is stopped, then
uh, or when
or
one should
when
stop the
one should stop the
prophylaxis, that
prophylaxis.
is a difficult
That is
decision,
difficult decision,
because
because
even though person is
even though
feeling
person is
good,
feeling
and
good,
if a
and if
prophylactic
a
treatment is
prophylactic treatment is
stopped,
stopped,
then it can
then
cause a
it can
rebound.
cause a
And one,
rebound. And one,
it is always better
it is
to
always
taper
better
the
to taper
medication.
the
Tapering is
medication.
always
Tapering
seen at
is
many
always seen
places.
at many
Tapering is
places. Tapering
happening.
is happening.
That means
That means if
what your
your
dose is
what's your dose is
given normally, that
given
has to be
normally, that has
slowly reduced. If
slowly
earlier it
reduced.
was around
If earlier
40
it was
milligram,
around
then
40
reduce
milligram,
it to
then
30 or
reduce it to
20,
30
and
or
then
20,
slowly
and
go
then
to 10,
slowly go to
and
10,
then go
and
to
then
5, and
go
then
to 5,
slowly
and
like
then
that.
slowly
So
like
each
that.
drug will
So
have their
each drug
own
will have
mechanism
their
of tapering.
own mechanism of
Particularly
tapering.
lithium is very
Particularly lithium is
important,
very
otherwise it
important.
can cause
Otherwise, it
rebound
can cause
activities,
rebound
and
activities,
it can be
and
very
it can be
severe,
very
and it
severe,
will be
and
difficult
it
to
will be
control.
difficult to control.
Then let us see
Then let us
what
see
data are
what
there.
data are
These
there.
are various
These are
articles are
various
there, and
articles
that
are
shows
there, and that
various
shows
treatments.
various treatments.
So this is one of the
So this is one
article
of the article which
the
shows
prevention of
the prevention of
rehospitalization in Finnish
rehospitalization in
patient with bipolar
patient with
disorders,
bipolar disorders,
and that was very
and that
large
was
study.
very
Around
large study. Around
18,000 bipolar
18,000
patients were
bipolar
followed for
patients were
25
followed for
years,
25 years,
and there were 9,000
and there
admissions in that
9,000 admissions in that
study. And
study.
these are the
And these
studies
are the
which
studies
shows. So
which
they have
shows.
studied,
So they have studied,
and on that they
and
have
on
found
that
the
they have
first one. So
found the first one. So
these many
this
drugs can be
many
added
drugs can
into
be
the
added
treatment of
into
bipolar
the
disease.
treatment of bipolar
It can
disease.
There can be
There can be
benzodiazepine, it can be
benzodiazepine, it
sedatives,
can be
it can be
sedatives, it can be
antidepressant, it
antidepressant,
can be
it can be
antipsychotics, it
antipsychotics,
can be mood
it can be mood
stabilizers,
stabilizers,
and then
and
gabapentin,
then
carbamazepine,
gabapentin,
then
carbamazepine, then
oxcarbamazepine, lamotrigine,
oxcarbamazepine,
valproic acid.
lamotrigine,
You can see
valproic
the big
acid. You
list
can
is
see the
there.
big list is there.
Topiramate,
Topiramate,
risperidone,
risperidone,
then perfenazine,
then perfenazine,
perisiazine,
perisiazine,
olanzapine,
olanzapine,
then sulpiride,
then sulpiride,
haloperidol,
haloperidol,
then
then
this dixirazine,
this
risperidone,
dixirine, risperidone,
then levo,
then levo,
uh,
uh,
promazine,
promazine,
mepramazine,
mepramazine,
haloperidol,
haloperidol,
aripiprazole, clonazepine,
aripiprazole,
quetiapine.
clonazepine,
So
quetiapine.
almost
So
who's
almost
who of
who's who
we
of
can see,
we can see,
and what they have
and what
found
they have
in
found
various
in
cases.
various cases.
See
They,
what this
see
study shows,
what this study shows, which are
all the data
all
that
the
favors
data
use,
that
and
favors use,
that
and
is favors
that is
non-use, or
favors
which shows
non-use,
that
or which shows that
these are
these are
not
not
beneficial, or they are having
beneficial,
more
or they are
toxicity.
having more
So when
toxicity.
we
So when we
have the ratio
have the
of
ratio of
benefit as to risk,
benefit as to risk,
so where the
so
benefit
where
is
the
more
benefit is more
and risk is less,
and
then
risk
we'll
is
say
less,
that
then
it
we'll
is
say that
favors the
it
use,
favors the
while
use.
where
While
the
where
risk is
the
more and
risk is
benefits are
more and
lesser, we'll
benefits
say
are
that it
lesser, we'll
favors
say
for
that
non-use.
favors for
So
non-use.
in that it
So
was
in that
found
it
that
was found that lithium was the best in that bipolar disease.
Then
Then
quercetin had
quercetin
only
had
modest
only
benefits,
modest
and
benefits, and
olanzapine was not
olanzapine was not
beneficial.
beneficial.
We have already seen
We have already
olanzapine
seen
having
olanzapine
more
having more
problems,
problems,
including weight
including
gain and
weight gain and
cardiovascular
cardiovascular
morbidity into it.
morbidity into it.
So it shows that
So it shows
olanzapine
that
was again
olanzapine was again
good one,
good one,
but
but
the benefits were
the
modest
benefits
as
were
compared to
modest as
lithium.
compared to lithium.
Olanzapine was having
Olanzapine
no
was
benefits,
having no benefits,
and the depot
and the depot
antipsychotics did much
antipsychotics
better
did
than
much
oral.
better than oral.
Why it can be? It was
What can
tried that
be?
means
It
because
was
of the
tried that
compliance.
means
You know
because of
what
the
do you mean by
compliance. You know
depot
what do you mean by
preparations?
depot
Depot
preparations?
preparation means
Depot preparation
where
means where
one dose is
one dose
administered
is
and that will
administered, and that will
be continuing for
be
long period
continuing
of
for
time.
long period of time.
It is given in such
It
a way
is
that
given in
the
such a way
drug will
that
be
the
slowly
drug will
released
be
for
slowly released for
at least more than
at least more
1 or
than
2 days.
1 or 2 days.
So
So
that means no
that
repetition
means
of
no
medication
repetition
is
of
there,
medication is
and
there,
in that
and
cases
in
these
that
depots
cases
will
these
be
depots
having
will
much
be
better
having
activity,
much
much
better
more
activity, much
activity,
more
and
activity,
therefore
and therefore
the why it was
why
found
it
better,
was
then
found
scientists
better,
feel that
then
it is
scientists
because of
feel
the
that it
better
is because
compliance,
of the better
because
compliance, because
there are chances that
there are
people
chances
may
that
tend to
people
forget
may tend to
tablet, or
forget
suppose
tablet,
there is
or
a severe
suppose there is
manic
a severe
episode.
manic
So
episode.
in that
So
cases
in that cases
the patient
the
cannot take or
patient cannot take
might not able to
might
take
not able
medication,
to take
and
medication,
even
and
relative cannot
even relative cannot
administer, because
administer,
he is in a such
because
a
he is in a such a
severe manic stage.
severe manic stage.
He is almost
He is almost
aggressive. He is becoming
aggressive. He is
very
becoming very
what we can say
what we can say
difficult to handle,
difficult to handle,
and vice
and
versa.
vice
During
versa. During
too much depression
too much
also,
depression
the
also,
patient may
the
skip
patient may
medication.
keep
So
medication.
if it is
So
depot
if it is depot
antipsychotics, they will be
antipsychotics,
better.
they will
They
be
will
better.
making
They will
more
making more
compliance,
compliance,
and therefore will be
and therefore
proven
will be
better.
proven better.
Bipolar disease
Bipolar
in women,
disease in
particularly of
women,
childbearing
particularly of
age,
childbearing age,
that is important.
that is
So in
important.
that
So
cases,
in that
there are
cases,
various
there
pros
are
and
various
cons of
pros and cons of
whether medication
whether
should be given,
medication
or
should be given, or
since the
since the
it can affect
it
the
can
fetus,
affect the
no
fetus,
medicine should
no
be given.
medicine should be given.
And then what should be
And then
done?
what should be
There
done?
are high risk
There are high
risk of relapse
risk of
during and
relapse
after
during and
pregnancy.
after
There are many
pregnancy.
reasons
There are
behind it.
many
Even
reasons
during
behind it.
pregnancy,
Even
many
during pregnancy,
hormonal
many
changes are going
hormonal
on,
changes are going
and
on,
though they
and
are,
though they are,
we can say that
we can say that
gonadotropic hormones,
gonadotropic
still
hormones,
they can have
still they
impact
can have
on
impact
various
on
mood
various
and
mood and
psychiatric
psychiatric
behavior of the
behavior of
females,
the females,
because it has been well
because it
proven
has been well
even that
proven
during
even
menstrual
that during
cycle or
menstrual
during
cycle or
menopause,
during
because of these
menopause,
changes in
because
the
of these
hormonal,
changes in the
there is a
hormonal,
change in
there
the
is a change in
mindset,
the
there is a change in
mindset,
the
there is a change in the
emotions,
emotions,
and change in the
and
behavior
change in the
pattern of the
behavior
females. It
pattern
has
of the
been found.
females. It
So
has been
during
found. So
pregnancy
during
also,
pregnancy
there
also,
are lot many
there
hormonal
are lot
changes are
many
going on,
hormonal
and
changes are going
therefore
on,
there
and
is a high
therefore
risk
there
of
is a high
relapse
risk of
during
relapse
and after
during and
pregnancy.
after pregnancy.
Bipolar disease
Bipolar
itself is
disease itself
associated
is
with the increased
associated with
risk
the
of adverse
increased risk
pregnancy
of adverse
outcomes,
pregnancy
and
outcomes, and
it has to be
it
checked
has to be checked.
during that. The
During that,
discussion and
the
monitoring
discussion and
is
monitoring
important.
is
Before
important.
conception,
Before
the
conception,
couple should
the couple should
reach to the
reach to the
consultants and get
consultants
their
and
advice,
get
and
their
then
advice, and
accordingly
then accordingly
simultaneously multiple
simultaneously
therapy can be
multiple
there.
therapy can be there.
Valproate is
Well, it is
absolutely avoided.
absolutely
Valproate should
avoided.
not be given
Valproate
because
should
of
not be
the
given
effects it
because
is
of
there.
the effects it is there.
Lithium initially was
Lithium
thought
initially was
as a
thought
very
as
risky
a very
because
risky because
it has got many
it
effects,
has many effects,
but comparatively it is
but
not
comparatively it is not
that risky.
that is
Cardiac
risky. Cardiac
malformation has been found
malformation has been found
in 2.4
in
patients
2.4 patients in,
as compared to
as
1.2
compared to
in the
1.2 in
placebo
the
control.
placebo
Lamotrigine,
controlled
quercetin,
lamotrigine,
olanzapine,
quercetin,
they are
olanzapine.
relative,
They are relative,
but
but
and they are
they are
similarly as a
similarly as
lithium. Even lithium
lithium. Even lithium
can be given after
can
first
be given
trimester.
after first trimester.
Next is physical health
Next is physical
monitoring
health
is
monitoring
important. It
is
has to be
important.
done.
It has to be done.
The same excess
The
mortality and
excess
cardiovascular
mortality
risk
and
are there
cardiovascular
as
risk are there
schizophrenia.
as
These people are
schizophrenia.
having
These
more
people are
proneness
having
for the
more proneness
mortality
for the
and
mortality
even
and
cardiovascular
even
risk. The
cardiovascular
physical
risk.
health
The
checks
physical
are
health checks
recommended
are
for the mood
recommended for the
stabilizers.
mood stabilizers.
Similarly, as
Similarly, as
antipsychotics,
antipsychotics,
lithium monitoring.
lithium
I told
monitoring.
you in
I
earlier
told you in earlier
class also,
class
lithium
also,
is one of
lithium
the
is
very
one of the
important
very
drug which has to
important
be
drug which has
monitored.
to be monitored.
And when you will
And
go
when
with
you
your
will go with
clinical
the
pharmacokinetic,
clinical
you will find that
pharmacokinetic, you will
you
find
have to
that
monitor
you have to
lithium
monitor lithium
because
because
its
its
changes in the
changes in the
concentration. If it
concentration, if it
if plasma
decreases, if plasma
concentration decreases too much,
concentration
then it can
too
cause
much,
relapse
then
or
it can cause
rebound
relapse or rebound
psychotic
psychotic
problem. And if it
problem.
is
And if it is
uh,
uh,
increase in
increase in
concentration, then it can
concentration,
cause
then it can cause
the changes,
the
particularly
changes,
cardiovascular
particularly in
and brain
cardiovascular
related
and brain
impulse
related
conduction
impulse
related
conduction
problem will be
related
there.
problem will be
And
there.
some of the
And
problem
some
can
of
be
the
very
problem can
severe
be very
because it
severe
mimics
because it
sodium
mimics sodium
ion,
uh,
and therefore it will behave
and
like a
therefore it
sodium
will
ion,
behave like
and
a sodium ion,
so
and
many signs will be
so
there.
many signs will be
So
there.
its level
So its level
should be checked,
should be
and
checked,
in
and
particular
in
various
particular
condition like
various conditions
renal
like
problems are
renal
there,
problems are
then
there.
accordingly
Then
dosage should be
accordingly dosage
adjusted in
should be
thyroid
adjusted in
condition, in
thyroid condition,
various
in
calcium
various calcium
hyper or hypo
hyper or hypo
levels. It has to be
levels. It
checked,
has to be checked.
and accordingly protocols are to be
Accordingly
made
protocols are
for
to be made
making it.
for making it. Uh,
So
so
this bipolar
this
disease
bipolar disease
are
are
omitted from NSF
omitted from NSF
nowadays because
nowadays
additional
because
activities are
additional
there. That is
activities are there.
this
That is
NSF
this
is there, that
NSF
is
is there. That is
national security for
national security
adults
for
are there in various
adults are
countries,
there in
so they
various
have national
countries. So
security.
they have national security.
So
So
if it is
if
omitted
it is
from the NSF,
omitted
then
from the
these
NSF,
people will
then
not
these
able to
people
get
will
any
not
funds.
able to get any funds.
It is not there in
It is
India, but
not there
in
in India,
US
but
and
in
other places
US and
where
other
NSF
places
is
where
there,
NSF is there,
then it will be
then
problem.
it will be problem.
And in that way,
And in that way,
they should have insurance for that,
they
so
should
that
have
they can do.
so that they can
There are
do.
some special
There are some special
bipolar disease clinic
bipolar
run at
disease clinic run at
various places.
various
Example,
places.
Warneford by
Example,
academic
Warneford by
psychiatrists,
academic psychiatrists.
but they do it for research studies,
They do it research
particularly for
studies,
clinical trials.
particularly for clinical trials.
They monitor
They
the
monitor
mood
the
remotely,
mood
and
remotely, and
if there is no
if there is
emergency
no
service,
emergency service,
it is not an emergency
it is
service,
not an
or
emergency
if they
service,
do not
or
get any
if they do not
complex or
get
chronic
any
cases,
complex or chronic cases,
and accordingly
and
they work.
accordingly they work.
Any this
Any
Oxford
this Oxford
is there, so
is
this
there.
is how they
So
are
this is how they are
taking the data
taking the
from
data
that.
from
So
that.
here
So here
we
we
gone through
gone
bipolar
through
diseases.
bipolar diseases.
These are,
These
as I
are,
told you, there are two
as I
poles.
told you, there are two
Basically,
poles.
lithium is found to be
Basically,
very good
lithium is
in that,
found to be very good in that,
and
and
there are two poles as
there are
we
two
have seen,
poles as we have seen,
and in
and
that the best
in that
treatment is
the best
lithium, and
treatment is
followed by
lithium, and
other
followed by
antipsychotic
other
agents.
antipsychotic
So,
agents.
and if at
So,
all we have
and
to
if
use
at all we have to
fluoxetine
use
or
fluoxetine or
SSRIs, then we have to
SSRIs,
combine
then we
them
have to
with
combine them with
antipsychotic agents.
antipsychotic.
So this is how we
So this
finish.
is how we
If you
finish.
have any
If
difficulties,
you have
you
any
may please
difficulties,
ask,
you may please ask,
and
and
please
please
suggest what are the next
suggest
topic
what
you
are the
would like
next topic
or
you would
to
like
go through
or
first,
will go through
so that it will
first,
be easy
so
for
that it
me
will
to
be easy for me
plan
to
it accordingly.
plan it
However,
accordingly.
the
However, the
natural course is
natural course is
depression. We have seen now
depression. We have
bipolar.
seen
We have
now
seen will go
bipolar.
for
We have seen
mania,
will go for
will go
mania,
from
will go from
schizophrenia, and then
schizophrenia,
other affective
and then other
disorders
affective
like
disorders like
anxiety disorders,
anxiety
and
disorders, and
various kind of
various
anxiety
kind of
disorders, sleep
anxiety
disorders, etc.
disorder, sleep disorder,
So we'll go
etc. So
accordingly.
we'll go
But if
accordingly. But
you
if
have any
you have any
choice, if you want
choice,
to
if you want to
make any choice, you
make
can
any
just tell
choice,
me.
you can just tell me.
Take care, be safe, and
Take care, be
let
safe,
me know
and